You're listening to WayJ, Grand Junction's OG Waylon Jordan, with on-demand content from Town Square Media's 99.9 KEKB in Grand Junction, Colorado. You're listening to WayJ, Grand Junction's OG Waylon Jordan, with on-demand content from Town Square Media's 99.9 KEKB in Grand Junction, Colorado. The Grand Valley's #1 for New Country, 99.9 KEKB. Here we are, the month of October, Breast Cancer Awareness Month. Get all the details, KEKBFM.com. Have special guests in the studio. Can I have you introduce yourself again, please?
Hi, I'm Dr. Courtney Fulton. I'm one of the breast surgical oncologists at Community Hospital. Thanks for having me.
Thank you for being here. Now, I guess maybe it's easy enough to think. You get a cancer diagnosis and you proceed. But let's say, for example, let's go back to square one, the beginning. You know nothing about having cancer. It may be just a possibility. And then you get the news. Does it happen that people get lost in the shuffle? They get distracted or something happens and things do not kick into gear. Does that happen?
Absolutely, all the time. So patients who are moving, patients who have a mammogram done at one place that doesn't have the capabilities of doing biopsy or a full workup, it can take weeks, sometimes months for them to get into the system. So the goal with Community Hospital is to try and get everything done in one place, get all the imaging, biopsies, surgical referral, and get onto treatment all within less than a week. So that's our rapid diagnostic clinic. So patients can reach out to our hospital, and even if they don't have a family doctor or they don't know what the next steps are, we can help them work through those symptoms and get them onto treatment faster.
So now on that note, let's say somebody, okay, first of all, mammograms starting at, you mentioned age 40, is that correct?
Correct. For average risk patients, age 40 is the new recommendation, and every year.
Hey, let's say, for example, a person has no reason at all to suspect they have breast cancer, but they do come from a history of people that do. What do you recommend for them?
So Community Hospital just launched our new high-risk screening clinic, run out of oncology with our genetic counselors. And basically, for patients who have a strong family history of breast or ovarian cancer, we can have them meet with our team, get worked up, and determine their personal risk of breast cancer and what they can do about it, including enhanced screening, preventative medications, preventative surgery, and we work out an individual plan for that patient.
Take everything you've just said so far. What it says to me is this does not have to be overwhelming. I don't have to be afraid of this process. Am I on the right track there?
Correct. You do not have to be afraid of this. We will walk patients through every single step of the way. And most patients tell me at the end of their cancer journey, they are so relieved and happy with the support provided by our entire oncology department that not that they're glad they had cancer, but they're glad they had us to walk them through it.
And I will personally vouch for that because I have dealt with the cancer, the oncology department at Community. Fantastic. I mean, the cancer thing could have done without, but the experience, incredible. So stay in touch. Okay, again, it's Breast Cancer Awareness Month, October. Get all the links to Community Hospital. You'll see them at our webpage, KEKBFM.com. The Grand Valley's #1 for New Country, 99.9 KEKB. October, Breast Cancer Awareness Month. Check out all the links at our webpage, KEKBFM.com. They'll take you right to all the great programs, all the great support at Community Hospital. Special guest in the studio. I'll have you introduce yourself one more time.
Hi, everyone. I'm Dr. Courtney Fulton. I'm one of the breast surgical oncologists at Community Hospital.
So when do we begin the process of mammograms? What's a good age?
For average risk patients, age 40 is when we start screening, and it's every year.
And let's say before the age of 40, I have concerns. I detect something that seems out of the ordinary. What do I do?
So patients who have a concerning symptom, like a lump, no matter their age, we offer full service, a rapid diagnostic clinic to get patients mammograms, ultrasounds, biopsies, and a meeting with myself to go through all of those symptoms and work up a treatment plan.
Do I have to have a referral from my family doctor?
It depends on the patient's insurance, but often not.
Okay, let's blank slate. I have a concern. Where do I start?
Well, if the concern is a symptom, then I would reach out to your family doctor first to help get us in touch with our office. However, we do take patient calls directly and can help patients navigate the entire process from start to finish.
Let's say I have no concerns, but I do come from a family with a history of breast cancer. What can I do?
So Community Hospital just launched a new high-risk screening clinic for patients with strong family histories of breast and ovarian cancer. The patient can meet with our genetic counselors who can determine their lifetime risk of breast cancer and work out an individual prevention plan or screening plan with them.
Okay, but let's say I do have a concern like we mentioned before. Is this going to be a lengthy process, or does it kick into gear pretty quick?
The process from detection to diagnosis can be extremely quick. So we aim to get all this done in less than a week from the time patients hit the door to the hospital.
There's also mentioned breast cancer. Does it exist with men?
Absolutely. So breast cancer is rare in men. Only 1% of breast cancers happen in men, but they often present with a higher stage or later diagnosis because either the symptoms go undetected or patients don't realize that they could potentially have breast cancer, so they don't think that a new lump is a concern.
Very good. Get all the info. Breast Cancer Awareness Month going on this October. We have all the great links going right to Community Hospital. You'll find them at our webpage. That's KEKBFM.com.